Power Living with Kimberly Langford, where inspiration meets empowerment. Kimberly is a nurse executive, leadership coach, Reiki master, and your guide on this journey to whole person wellness.
Hey, it's Dr. K.
Wonderful. Thank you.
We had a show here called, did you ever hear the show Fat Albert?
Yes.
Yeah, so hey. Anyway, Dr. Kikkeri, I'm so glad to have you on our podcast today as we talk about, it's interesting because hospital-based services, whether it's inpatient or outpatient, off the charts, and it's eating a hole into everybody's wallets. And, surgery, procedures, whatnot, we typically, it's not like buying a washing machine where more money gets you a better deal, right? And so, but I don't know that everybody knows that about healthcare, how, inverted the industry is. But today we're talking a little bit about the glory of bundled pricing and helping members find the optimal site of care at the optimal price with optimal outcomes through a better experience with like an ambulatory and an independent surgical center with bundled rates. And so I'm really glad to have you here as we talk about how your model can have such a profound impact on the financial and the surgical risk for these folks. But if you wouldn't mind, I would love, because your story is so inspirational. Would you mind just sharing with us a little bit about your journey and, what was it as a medical doctor, anesthesiologist? What is it that started you down this path? What's your why, Dr. K?
I have the biggest why I got started was it happened several years ago when I was practicing in my clinic. I continue to practice pain management in clinic, and I'm an anesthesiologist. I practice both anesthesia and pain management. And I got a call from one of my surgeon friends to come to OR3. When a surgeon calls, the anesthesiologist usually runs to that op because we don't know what's going on. So when I went there, I said, no medical emergency. Just wanted you to look on the monitor, TV monitor. He was doing a diagnostic laparoscopy. And on the TV screen, there was the picture of the liver where he was doing a laparoscopic examination. On the surface of the liver, there were diamond-studded spots. And as you and I both know, that's a very ominous sign. Yeah. And unfortunately, it was a metastatic colon cancer. Metastatic colon cancer, when it goes to the liver, it's very, very difficult to treat. And that is the part of the story. And he said, Dr. K, look on the other side of the ether screen. On the other side, look at her face. When I looked at her face, that was a shocker. And this is the lady who used to come and get preventive colonoscopy with us on a regular basis. And because of increased in her deductible due to Affordable Care Act, she could not afford her care. She stopped coming. So precancerous polyps became cancerous polyps. And then it spread. When it spread without her knowledge, she developed some stomachache. And then next thing you know, unfortunately, she passed away. And this story, we knew her because she used to come more frequently, and we get attached to our patients.
The family it was preventable.
Yes.
Largely preventable.
Absolutely. And when I spent time with the family, they said, hey, Dr. K, I wish we knew we as kids, we could have pitched in and gotten her the care that she needed. She never told anyone. And that's the time when I went home, I did not feel good about the whole thing. I decided to be a doctor when I was in sixth grade. Sixth grade. So when I looked at the big picture, in this day and age in the United States of America, this should not happen. But unfortunately, this does happen. Even now, it happens.
Yeah.
So I wanted to come up with some solution. I gathered some of my like-minded people in our team and then got together and came up with a bundle price procedure. How we can make it affordable so that it's easy to afford and then make it simple to buy it. So that's how we got started. We started with a colonoscopy. Subsequently, we spread to other surgeries like hernia repair, gallbladder surgery, orthopedic surgery, kidney stone surgery, and then joint replacement surgery. So from one, we have spread to different specialties. Subsequently, we had to help patients coming from different parts of Texas. So different parts of Dallas Fort Worth Metroplex. So we started administering this in not just our surgery center, in different surgery centers.
Mm-hmm.
And then in a similar fashion, we were asked to help different parts of Texas. One of my patients was HR head of the HR in a big self-insured employer. So he introduced us to the concept of working with TPA. So we have been working with self-funded, self-insured, and we have been helping them throughout Texas. Subsequently, we grew again. Now we are providing this care in 17 different states in United States. This is about, thank you. This is how we begin. Now, having started with bundle surgery, this has been a very fulfilling journey. And when I see people like you who are passionate about helping people in our industry, when we put our heads together, we can touch a lot of lives.
Yes, we sure can. And we tend to find each other, don't we? The
Ma'am.
self-insured industry, it's not such a big industry that, good folks can't find each other who share that mission. We just need more of us. And, it's interesting because what I have found is that the healthcare system that I grew up in my young nursing years, it just doesn't exist anymore. Haven't seen it for a long time. It's become very commoditized and fragmented, and multiple superfluous layers. And so it largely feels like we are using patients and clinicians. We move them around like a chess piece on a chessboard to get to the dollar bill. And that really does hurt all of us. And so when you think about a model like this, like your model is really notorious for, very transparent, upfront pricing, no nonsense, predictability, improved outcomes for members, and more satisfactory work life for the clinician as well. And matter of fact, I was talking with somebody today about, I remember all the hours I wasted on the phone doing trying to get an auth and then tracking down payments. Really difficult. So, if a lot of times when we think about transparent pricing, bundled options, independent surgical centers, this really is not just about cutting corners or cutting costs. Can you share a little bit about, what's the value add there in terms of cutting out the waste and improving outcomes, and not just for the health plan and the member, but also for the clinician.
Couple of things that you mentioned when you're talking to me. You mentioned about commoditizing, how it has been commoditized. So it is from what we started as a bundled surgery program. And now we, out of necessity, had to grow into specialty surgical risk platform. You cannot, there is a big difference between going to a grocery store, buying a gallon of milk. There's a big store. There are a lot of ways you can see that, yeah, I'm buying a gallbladder for X number of dollars. I'm buying a colonoscopy for X number of dollars. Please understand that is commoditizing the healthcare. We are human beings. What is my health history? What is my need is different than yours.
So when you cut open your insides, they might look a little bit different from the next person's.
Yes, absolutely. Not only that, but also when I, as an anesthesiologist, when I see patients this today, when I saw, and the patient's first response was that they call me Dr. K because it's easy to pronounce. I said, hey, Dr. K, I'm so glad that I got a chance to talk to you because I was nervous what's going to happen. Mm-hmm. Surgery is not something that people come and have every day. Yeah. So that is a very good concept. So in our new business that we grew into out of necessity, we have incorporated the surgical navigation, which is a part and parcel of our bundle surgery, where we handhold the patient, walk them through the entire process from the time that they are ordered the surgery and schedule the surgery. And then they are done with the surgery. For the following 30 days, we follow them. And at the end of that, we give that report to the self-insured company, our TPA that we work with, so that they know exactly, hey, this is what happened. These are the things that they did to prevent the risk even before the surgery. Yeah. So they matched the patient's need to the surgeon, to the facility, to the anesthesia. So, and almost all the time, the implant is included. For a colonoscopy, pathology is included, so that patient experience becomes individualized strategy where it is done with a human touch.
No cookie cutter cutting, so to speak. Yeah.
No, ma'am. It doesn't work.
Yeah. We like designer care. We are designer, absolutely. So members have a better experience. What about, how is it? Maybe you can explain for those that don't know, where does the claim come from that a member is going to have a better outcome than they would in the hospital with the big shiny billboard and the huge campus?
Yeah, and that's an excellent question. And you mentioned early on in your meeting saying that, hey, higher price doesn't mean higher quality. So how do you measure a quality of a surgeon? How do you measure the quality of a hospital or a surgical center? How do you measure the quality of the care of anesthesia that they're getting? How very, very important. How do you measure the quality of the nursing care, which is the central part of all these things? If all these things are taken into account, we came up with an algorithm that has quality metrics. And these quality metrics must be met. Okay, so you can have all the fancy billboard that you want to have, and you can do all those things, but it has to match what we expect out of them, so that the ultimate person who gains from this is the patient.
Yeah, those key performance, key quality indicators. Too, and the thing that comes to my mind, a surgery, a procedure, a hospital stay becomes more and more expensive when people are sick. You get an infection, or you don't have the proper care. That becomes a very expensive stay for sure. Maybe you can talk a little bit about, what makes a bundled surgical price, and how does that impact what the customer experiences? Oftentimes they'll get several different bills and they're like, what the heck? It feels very fragmented and they have no idea what they're paying for. Maybe you can share a little bit about, that experience and how that's different.
Yes, ma'am. I've been a doctor since 1988. Okay, I just gave out my age. Yes, I do color my hair. For those
you were 6 years old then, right?
So if somebody who has been doing medicine for a long time, if I can be confused with multiple bill, deductible, out of network benefit, allowable, and you can use all those jargons and confuse me. Imagine what a non-medical person would go through. And on top of that, there is a fear of, garnering the wages. There is a fear of losing a home.
Getting sent to collections.
Sent to collection. Yeah. And along the same line, I will tell you that the last year's statistics, about 1,000 families declared medical bankruptcy every single day. This year, medical statistics, 1,464 families declare medical bankruptcy every single day, and it's going up. So this is our way of very, very small way of helping American families, not declaring bankruptcy. So this is how patients are assured that this is a one bill that you'll get. This one bill includes anesthesia, facility fee, surgeon's fee, surgeon's assistant fee. If there is a knee replacement hardware that is involved, it includes that. If it's a colonoscopy, routine pathology is included. What is not included is, the images, like specialized images, any images before the surgery. And if they need a cardiac evaluation that you need for optimization, those are not included. Patients will know ahead of time and they will receive one bill. That's it.
Yeah, that's wonderful. And so that obviously has a financial impact. But the clinical impact sometimes is a little more mysterious. Maybe you can talk about the impact of that bundled price on the clinical experience.
Number one, as I was telling earlier, the surgery itself is stressful. The finance should not add more stress to it. And that increases their blood pressure and their outcome. So when we have the clinical experience, when somebody who's caring holds their hand and brings them through walks them through the entire process, knowing that, hey, I can budget this amount for this.
Yeah.
When you budget this amount for that, they know exactly what they're going to pay. And they're, especially in a company, when we have a self-insured company, some of the companies, what they're doing, which is I truly appreciate, who care, they have made, number one, zero
out of
cost
pocket
for the patient, zero cost for preventive care, such as preventive colonoscopy.
Mm-hmm.
And these are awesome. And what they feel is that they feel appreciated by their employer. And the other way they do it, they waive their copay. So this is how it is addressed.
Well, and it's interesting that you say that, because I have had patients in the hospital, before you even finish the admit paperwork, they're stressed and they're asking, what is this likely going to cost? Because they have no idea. And that is very stressful. The other thing that that comes to mind is where oftentimes in that experience for the member, not only do you have the less stress with the transparent pricing and whatnot, but when you look at it from the employer's perspective and being able to forecast what their spend is, or in terms of underwriting, it's much easier for the plan. And oftentimes what we've seen is that a plan can save so much. That's why incentivizing members by just what you talked about, zero out of pocket, no deductible kind of thing, because the employer saves so much. And not only in the cost of the surgery, but in the risk reduction as well, which we don't often think about, the risk reduction, because that can be really expensive to have, a complication or infection or something like that. And when you talk about that in terms of lowering that kind of risk, what is it that actually makes a surgery at an independent facility? What is it that clinically, what is it that you talked a little bit about that earlier. I mean, what is it that you do that actually lower, because the infection rates are significantly lower at an independent site. So what's the magic there?
Yeah, number one, you had asked about how do we decrease the surgical spend? Okay. And in all sincerity, I'm grateful for people like you, because you not only watch, I know, because we meet every month, we go through every single case. We not only look at it from the surgery, how much money was spent, what is the member experience, underline member experience. And you also speak about, hey, how much money did we save? And all these things you address. And I'm telling you, Boone Chapman is lucky to have you, because you watch this. You watch this. So when we look at different aspects of reduction in surgical claim, so when there is a decrease in the surgical claim, when each and every patient's surgical spend is accountable, and and then this decreases their stop loss insurance rate, because this is when we optimize them ahead of time. Because please understand, a colonoscopy for somebody who with no risk is different from colonoscopy with somebody who has 3-vessel heart disease, who is more prone for heart attack.
Yeah.
So we can, because we have wonderful nurses who go through this chart and stratify ahead of time, and we run it by our anesthesia team, and then we optimize that. It is something that has evolved over a period of time. It did not happen overnight. So all these things, we always ask the question, what can we do better? What can we do better? What can we do better? So when we came up with this strategy, it has tremendously decreased the surgical, not just surgical spend, decrease in the stop loss insurance, decrease in the lasering of different things, and with a tremendous increase in the member experience.
Yeah, and it's interesting. I was talking with a fellow nurse today, actually, and we were talking about, in her hospital setting that, the churn, because it is that I love making money. It's one of my favorite hobbies. However, if that's your goal, if the revenue is your goal, if that's what you're chasing, well, good luck, because you're always going to chase it. That's a hard way to grow a business and a hard way to live a life. When you're chasing instead more noble purpose, you're chasing instead higher quality and joy in the work that we do. And how many clinicians do you know do not enjoy their work anymore? They hate it. The stress for nurses who carry way too many patients to be safe. And heaven forbid if they say, you know, I'm not going to take this load because it's too many patients for me to safely handle. Well, you know, then they're in trouble, not the hospital who's optimized their revenue for, you know, that's what drives the staffing instead of the quality of care. So all those levers, when you think about that, I think about, you know, the incentive that actually drives the different result, or the tail that wags the dog, right? Or the head that wags the dog, whatever that expression is. And I think, you know, when we operate with that, if your goal, our goal here is always the member is always in the center of everything we do. And I firmly believe, and I found this to be true throughout my career, when you put the member in the center, everything else will fall into place, including money. Money will start chasing you and not you it. And that's a glorious way to not only to grow a business, but to grow a meaningful impact in the lives of the clinician and in the lives of their patients. It's a totally different model because of the incentives.
I wholeheartedly agree with you. And this day and age, when procedures are getting denied right and left, and the care that is provided to the patients are getting denied right and left, physicians are getting frustrated so much that they have to spend hours on ends in appealing the denial. And what used to be a very enjoyable journey is now physicians, majority of them are stressed out.
100%.
And unfortunately, it is a system that is bound to have a very rough time ahead. Very rough time.
Absolutely. I mean, people don't perform at their peak when they're miserable. I do not want a doctor or a nurse taking care of me when they're miserable, because that makes me nervous.
You want a happy, competent doctor.
100%. 100%.
You want a happy, competent nurse. You want and the nursing care is something that is really, really important. That is one of our quality metrics.
Yeah, 100%. Let me ask you this question. For an employer or an insurer, a plan, what kind of surgeries, what kind of procedures benefit most from this kind of model?
Usually, when any new employer or new client joins our thing, we try the high dollar surgeries, like
it's triage.
Yes, like a spine surgery, including laminectomies, spinal fusion in the neck fusions, and what have you. And for joint replacement surgeries and other like knee scope or shoulder scope, shoulder replacement surgery.
Oh, yeah.
And these are all the high dollar surgeries that is commonly used. And then comes the middle part, which is more frequently used. That is gallbladder surgery, hernia repair. And then comes the one that is used most, that has the highest impact on their number one, patients' lives, and also the surgical spend later on down the line. That is preventive colonoscopies in the surgical field. And I took care of a patient yesterday doing anesthesia. A healthy young man with no medical history. And the gastroenterologist was so smart in finding out the precancerous condition and took it out with the scope before it became any. This is like such a fulfilling experience.
Yeah, absolutely. And, you know, it's interesting that you brought that up, and especially with your story that you shared as we started our conversation, because, you know, we were making some headway before COVID hit and everybody went in their shells and nobody was getting their screenings. And now might as well have that all over again, because to your point, I mean, I know families who are paying more in their premiums just for the privilege of carrying around an insurance card than they are their mortgage. And they can't even access it until they blow through, sometimes a $10,000 to $15,000 deductible. And I don't know what kind of access somebody has in that kind of a situation. And, when you talk about how in this model where, we can really go after the low hanging fruit, where are you going to have the biggest impact on the plan and the member is in those catastrophic, those high dollar cases and the high frequency cases, right? Where you're going to have the biggest immediate impact. And in so doing, not only do you have a better experience for the member, and obviously there's more joy in the work for the clinician as well, but you're also preserving those plan assets, which members who will never intersect, never need health care, they're also benefit from that model as well, right? Because, they're not paying the higher shared premium pool for the higher risk that's in that population. So,
Yeah, along the same line for the high dollar surgeries, we have, because of the demand, we offer um, second opinions so that before they go into bigger surgery. We had a patient that came from Oregon and was charged was going to charge the company $60,000 for what's called a sacroiliac joint fusion. Sacroiliac joint fusion.
not terribly uncommon.
No, it's not terribly uncommon. And about literally 2 hours ago, I did a SI joint fusion myself today at our surgery center. And I promise you, it's not even 1/10 of what we spent on that. So when they sent the patient from Oregon to us for the second opinion, when I had it reviewed, and when we said what we said, patient company offered the patient to do this surgery with no out-of-pocket expense to the patient and flew the patient from there to our facility and had it done. And we were able to take care of this. Now we can find those places in Oregon to help this. They don't need to fly here. So these are the stories, real life stories that make a big impact.
Well, it's interesting because in that model, not only you're driving down costs and improving outcomes, but you're improving access to care. I mean,
Yes.
If you can't afford it, you have no access. So that's really incredible. I know you and I have talked about this before, but I would love to see this model take over healthcare. And, at Boone Chapman, it's one of our big drivers is how can we foster more utilization of these independent centers? Because we see from the spend side, the spend is less, members are happier, they have a VIP kind of red carpet experience. They're not treated like cattle, shuffled along through the stalls kind of experience. And that's really profound in terms of impact for an entire health plan as well. What do you think? What do you think the future is in terms of surgery? Where are we going to go when you pull
I
out
have seen the businesses struggle these days, really struggles to keep the door open, keep the lights on in their building, because it is very difficult. One of the biggest spend that they have is that employee health care. That's why they're turning to people like Boone Chapman to help manage that. And when we combine that with what we offer as a surgical navigation, hand-holding, risk reduction of the risk, and offering them low-cost surgery, you in Boone Chapman are helping to keep the businesses open. You're helping to put the food on the table for so many employers. So the future, the way I see, is that we have to. This is.
But you were saying something magnanimous. It was important.
So So what I was saying is that people, the businesses, when they have difficult time in keeping the doors open, they have to find ways to take care of their employees, take and cut the healthcare expenses down. One of the biggest healthcare spend comes from surgical spend. So, and when the surgical spend is done with surgical navigation, risk reduction, and in a bundle manner, cost becomes predictable. That's where Boone Chapman is doing a phenomenal job. And I have been working with Boone Chapman for a number of years. It has been, and especially since we got to know you and your team, it's been a delight to work with you
Oh,
because it's at the end of the day, we are aligned in our goals. We are aligned in our drive and passion to help people.
100%. It's a great mission to be involved in. So I guess, my takeaway from our conversation today is that, better surgery isn't just cheaper surgery. It's actually more intentional. It's designed with the member in the center, in that episode of care and the outcome. It's not just cutting corners. It's really about adding value and experience and increasing that access. It's a beautiful model.
Absolutely. And I wholeheartedly agree. And we can change one life at a time for the better.
100%. Yeah. And even more as you continue to expand. I know you're growing. Boone Chapman is growing as well. So, whether it's maybe a broker, an employer sponsored health plan, or maybe a doctor who's like, how do I work with this guy and join his model? How do people find you? How do they get in touch with you?
It's easy to reach me. And I'm on LinkedIn, and our website is hinkapinhealth.com. And HINKAPIN health.com. And
so tell me, how did you devise, where did the name Hinkapin come from?
I honestly, it came up with because my son invented that name. There is a tree that gives shade to a lot of people. It's a comforting tree. And the name is not directly related to that tree, but it is akin to that tree. It is something that gives the shade.
Oh, I love that. We need shade in this day and age from the scorching rays of a healthcare industry that has become, largely anything but caring.
Yes,
And
ma'am.
so, being able to work with you and your team really, truly, it's a great honor. And, we are bringing care back into healthcare. And that's why, folks like you and others, that's why we come. That's why we, come into healthcare, in the first place. And if you're in the industry for a while, it kind of beats it out of you. So to find a way back in with a vehicle where you can really do something of significant good in the lives of others is such a blessing. So thank you for that.
The feeling is mutual towards you and your staff and Boone Chapman.
I'll pay you later, Doc.
Thank you.
Well, thank you so much for your time and your expertise. I can't wait for part two. Part two, we get to talk with your sidekick, Adam, who's a fantastic crackerjack nurse. Not only that, but he's head of the Texas Surgical Association?
Texas Ambulatory Surgical Associate.
Yeah, so he's a boss in the industry as well. You don't work with small players, you work with real experts. Well, I think that makes a big difference too. So anyway, thank you so much for your time, Dr. Kikkeri. Great pleasure.
Thank you, Beck. Thank you.